Over the past 100 years, many different books, movies, and TV shows have been made about vampires, none more famous than Bram Stoker's Dracula. Despite the fact that none of these stories are exactly the same, many of them depict vampires as having the same basic characteristics. Some of these characteristics include superhuman strength, pale, icy blue eyes, and of course, their inability to be exposed to sunlight for long periods of time without bursting into flames. Perhaps a vampire's most well-known characteristic is their unquenchable thirst for blood. When it comes to vampires, some of their well-known characteristics are much more plausible than others, like abnormal strength, blood around their mouth, large canine teeth, pale blue eyes, skin burning in the sunlight, and their tall stature. However, some are just downright impossible, such as turning into a bat, hypnotizing people, and not displaying an image in a mirror. Vampires' abnormal strength can be explained by myostatin-related muscle hypertrophy, or MRMH. Myostatin-related muscle hypertrophy causes individuals to have a decrease in the amount of fatty padding on the body and an increase in muscle mass, resulting in a higher degree of strength. It is easier for individuals with MRMH to gain muscle mass due to their decreased levels in myostatin, a protein that limits the growth of muscles. A vampire's sun sensitivity can be explained by erythropoietic protoporphyria. EP is a disease that is characterized by extreme sun sensitivity, and when a person with EP is exposed to the sun for too long, they can experience burning, swelling, itching, and even minor to severe burns. A vampire's token large canine teeth can be explained by hypohidrotic ectodermal dysplasia. Hypohidrotic ectodermal dysplasia is a rare genetic disease in which causes congenital defects of certain structures of the ectoderm. The teeth of a person with HED are shaped in such a way that they come to a sharp point, almost as if they've been filed. A vampire's icy blue eyes can be explained by microbial keratitis. Microbial keratitis is an infection of the eye that can be caused by bacteria, fungi, or even injury. The infection is characterized by pain, blurred or decreased vision, light sensitivity, excessive tears, and eye redness. The infection, while making the white of the eye red and irritated, can also lead to the discoloration of the cornea. The blood seen around the mouth of the vampire can be explained by tuberculosis. Tuberculosis often affects the lungs and causes those with the bacteria to cough, run a fever, lose weight, and cough up blood. If one were to have a more severe case of tuberculosis in which the disease had progressed, it is more than likely that he or she will cough up blood due to the disease-caused lung damage that occurs. Lastly, a vampire's daunting stature can be explained by acromegaly. Acromegaly is caused by the hypersecretion of growth hormone, which results in uncontrollable growth. Acromegaly usually manifests during adulthood and affects bone growth, specifically in the hands, feet, and face. But most importantly, if you're ever unsure if someone is really a vampire, run.